This is another bit of ultrasound with Z. This time, how to get an ultrasound image. Bedside ultrasound can be complicated. A provider needs to decide to perform, then interpret, and then integrate the information into patient care. I want to focus on one small piece of this, obtaining an image. Before starting, there are 3 movements possible with the ultrasound probe: rotating, fanning, and rocking. To get an image, you need a window which allows the sound waves to be transmitted to what you want to see. In this case, I'm sliding the probe over towards the liver to use the liver as a window to see the gallbladder. Remember, ultrasound does not travel well through hard surfaces like bones or air like bowel gas or lung. Turn the machine on. Let's keep it simple. You will need to make 2 adjustments on the ultrasound machine: depth and gain. Depth controls the depth that the machine is imaging, and gain controls the brightness of the image. You want to fill 2/3 of your screen with the area of interest, whether it is the heart or a kidney or anything else. Meanwhile, you want the image bright enough to see structures, but not overly bright that you are misinterpreting fluid or other black structures. Place the probe in the area of interest. Be sure to anchor some part of your hand so that you don't drift with the probe. If you see something, you likely have a good window. If you see nothing, then you don't have a good window, and it is time to slowly move the probe until you do see something. After you see something, it is time to rotate, fan, and rock until you see what you need to. All movements need to be slow, slow, slow. Keep your eye on the screen while you make probe movements. After obtaining your image, press freeze. At this point, you can label the image and be sure to push the save button. Sometimes you might have the perfect image, but then it disappears. That is okay. Quickly push your freeze button, and nearly all machines will allow you to scroll back until you return to the image you had. At this point, label and save it before continuing further scanning. A few tips. If you're struggling, be sure you're using lots of gel and good pressure. Thanks.